Good evening, doctors. Today we are going to do the MCQ challenge of pharmacology. This pharmacology has a good weightage in the NEET PG exam. About 20 questions from pharmacology come in NEET PG and 15 questions in the INACT. And a broad-based knowledge of thorough knowledge of pharmacology will also gives you an edge in solving MCQs in medicine, pediatrics, and sometimes even surgery also. So let us begin with the first question. Clinical effect of vitamin D is reduced by. Now, what do you think about this vitamin D? Clinical effect of vitamin D is reduced by A. Simultaneous ingestion of phytates. B. Simultaneous ingestion of lactose. C. Acidic environment. D. None. Now, what is the main clinical effect of vitamin D? The main clinical effect of vitamin D is enhanced intestinal absorption of calcium. With an average intake of 1000 milligram of calcium, its net intestinal absorption is only about 150 to 250 milligram per day. This calcium is absorbed mainly in the duodenum and jejunum, that is proximal intestine, by an active transport mechanism regulated by 1,25 dihydroxy vitamin D, that is calcitriol. This parathormone indirectly promotes the absorption of calcium by increasing the renal synthesis of 1,25 dihydroxy D3, dietary lactose, protein, and acidic environment promote calcium absorption. On the other hand, phytates, phosphates, oxalates, tetracycline, and an alkaline environment impair calcium absorption. So phytates, phosphates, oxalates, tetracycline, and alkaline environment impair the calcium absorption. Lactose, protein, and acidic environment promote the calcium absorption. So the correct answer here is simultaneous ingestion of phytates. Yeah. Which of the following is a drawback of extended release preparation? A. Frequent high peak side effects. B. Decreased compliance. C. Increased cost. D. No dose dumping. These extended release drugs are associated with gradual rise in drug plasma concentration that is maintained throughout the day, thus avoiding peaks of high and troughs of low plasma concentration. By delaying drug action, the number of doses required considerably decreases and hence compliance increases. Though the cost is higher than normal patient drugs, extended release drugs, if taken with food, more amount of drug can be released, which is known as dose dumping and which can cause toxicity. So it is the increased cost. Which of the following drug toxicity can be seen in Crigler-Najjar syndrome? A. Tenofovir. B. Zidovudine. C. Atazanavir. D. Nevirapine. See, the drugs with established toxicity in case of Crigler-Najjar syndrome are irinotecan and atazanavir. Irinotecan, atazanavir. These drugs are metabolized by glucuronidation. So the correct answer here is C. Atazanavir. An acidic drug is maximally absorbed from A. Stomach, B. Small intestine, C. Large intestine, D. Oral cavity. It is small intestine. An acidic drug is mainly unionized in the stomach, but as it has a thick mucosa and a small surface area, maximum absorption takes place in the small intestine. So correct answer here is B. Small intestine. Which of the following is the fastest acting receptor? A. Beta 1, B. M2, C. GABA A, D. Estrogen receptors. So the correct answer here is GABA A. Ligand gated ion channel are the fastest acting receptors. Out of the options, the only ion channel receptor is GABA A. So the correct answer here is C. GABA A. Anandamide is A. Opioid, B. CK1 antagonist, C. D2 blocker, D. Cannabinoid neurotransmitter. Now, what is anandamide? Anandamide is also known as arachidinoethanolamine or AEA. It is an endogenous cannabinoid neurotransmitter. The name is taken from Sanskrit word ananda, which means bliss and delight, and it is an amide. It is synthesized from N-arachidonyl phosphatidyl ethanolamine by multiple pathways. It is degraded primarily by fatty acid amide hydrolase (FA) enzyme, which converts anandamide to ethanolamine and arachidonic acid. As such, inhibitors of FA lead to elevated anandamide level and are being pursued for therapeutic use. So the correct answer here is cannabinoid neurotransmitter. The drug in the delivery system given below in the figure is A. Topical use, B. Systemic use, C. Both topical and systemic use, D. None. It is systemic use. Which of the following drug is preferred in WHO stage 4 for the condition given in the picture? Now, here in the picture, you can see there are prominent pulmonary arteries in the X-ray, which is consistent with the diagnosis of pulmonary arterial hypertension. For stage 4 pulmonary artery hypertension, the drug of choice is IV epoprostenol. So the correct option here is C, epoprostenol. Acidic drug binds to A, globulin, B, alpha 1 glycoprotein, C, albumin, D. This acidic drug binds to albumin. It is best absorbed in the stomach. The acidic drug is ionized in the intestine. Acidic drug is excreted quickly in the alkaline urine. Now, what about basic drug? Basic drug binds to alpha 1 glycoprotein. Basic drug is best absorbed in the intestine. Basic drug is again ionized in the stomach. And basic drug is excreted quickly in acidic urine. So, the correct answer here is C, albumin. The drug in the picture is used for A. Breast cancer, B. Routine contraception, C. Emergency contraception, D. Abortion. See, the two tablets of levonorgestrel given in the picture are used 12 hours apart for emergency contraception. So the correct answer here is C, emergency contraception. Sugamadex is used for, you can directly WhatsApp me on this number 948-365-2020 for any clarifications. And you can join the WhatsApp group so as to attend the 2-day Neet PG Breakthrough Blueprint Masterclass, which gives you a strategy to crack the Neet PG. And it also covers all the 19 subjects in the most holistic way possible in the shortest possible time. The first 10 students who click the link in the description will get this masterclass, very valuable masterclass, absolutely free. So please click the link in the description box. If you have any difficulties in any topics or you want any topic which feels very difficult and want to be covered in the masterclass, you can WhatsApp me directly on this number 948-365-2020. The 2-day masterclass is next Thursday and Friday. Sugamadex is used for A. Organophosphate poisoning, B. Reversal of neuromuscular blocker, C. Treatment of local anesthetic poisoning, D. Treatment of central anticholinergic syndrome. See, it is the reversal of neuromuscular blocker. Sugamadex is a novel reversing agent developed for terminating the action of non-depolarizing muscle relaxant, rocuronium and vecuronium. It is a modified bicyclodextrin with high affinity for rocuronium and vecuronium. It encapsulates one molecule of neuromuscular blocker within its molecule, forming an inactive chelate which is excreted in urine. Its side effects are mild precordial pain, nausea, alteration of taste, and rare allergy. Mode of excretion of cyclophosphamide is A. Lung, B. Liver, C. Kidney, D. Skin. It is kidney. Cyclophosphamide is primarily metabolized 80% and metabolized excreted in urine. 10 to 20% is excreted unchanged in urine and 4% is excreted in bile. So the correct answer is C. Kidney. Please click the link in the description box to join the 2-day ultimate Neet PG Breakthrough Blueprint event, which is going to be held next Thursday and Friday morning 6:30 a.m. sharp. Click the link, Join the WhatsApp group. You will get the further information on this. And the first 10 people who join this WhatsApp group, please stay in the group till you get selected because lots and lots of material is going to be uploaded in this WhatsApp group. What is the type of receptor given in the picture? A. GPCR, B. Ion channel receptor, C. Enzyme link receptor, D. Nuclear receptor. It is ion channel receptor. The pentameric structure in the picture is nicotinic receptor made up of 2 alpha, 1 beta, and 1 delta subunit. Nicotinic receptor is a Na ion channel receptor. Duration of action depends on A. Clearance, B. Rate of elimination, C. Bioavailability. In fact, it depends on all the things: clearance, rate of elimination, bioavailability. So, correct answer here is D. Which of the following drug can cause thyroid dysfunction? Most commonly asked MCQ is A. Amiodarone, B. Ampicillin, C. Ibutylide, D. Aceclidine. The drugs causing hypothyroidism are lithium, sulfonamide, phenobarbital, phenytoin, amiodarone, para-aminosalicylic acid, rifampicin, carbamazepine. So the correct answer here is A. Amiodarone. Which of the following anti-migraine drug might have caused a side effect in the picture? A. Sumatriptan, B. Propranolol, C. Methotrexate, D. Ergotamine. Ergotamine can cause severe peripheral vasoconstriction and gangrene organ within the arteries like fingers. It is ergotamine. Dopamine, all of the following is true. Now let us know something about dopamine. Dopamine acts on D1 and D2 receptor and adrenergic receptor A1, A2 receptors. With no action on at lowest effective dose, it stimulates the D1 receptor in renal and mesenteric blood vessels, so it improves the renal and mesenteric perfusion. At moderately high dose, it acts as a beta agonist, that is positive inotropic. At high doses, it activates alpha adrenoreceptor. So the correct answer here is causes increase in GI-ischemia, which is not correct. The side effect of digitalis are all ventricular tachycardia, vasodilatation, nausea, vomiting, ventricular bypass. See, digitalis causes mild vasoconstriction and not vasodilatation. So the correct answer here is B. Vasodilatation. Anti-androgen used in heart failure is A. Carvedilol, B. Samprolactone, C. Spironolactone, D. Amlodipine. It is spironolactone. Spironolactone and eplerenone are aldosterone antagonists. They are used as potassium-sparing diuretics. Their diuretic effect is quite feeble, but in congestive heart failure, these drugs reduce the mortality. So, spironolactone also causes anti-androgenic. Which of the following drug might have caused a side effect given in the picture? A. Antacids, B. Bismuth, cisaprate, sucralfate. It is bismuth. Gemcitabine is used mainly in which cancer? A. Colorectal cancer, B. Breast cancer, C. Pancreatic cancer, D. Craniopharyngioma. It is pancreatic cancer. Maximum liver toxicity is seen with which anti-TB drug? A. Isoniazid, B. Rifampicin, C. Pyrazinamide, D. Streptomycin. It is pyrazinamide. Fastest acting antithyroid drug is iodide of NAK, B. Propyl thiouracil, C. Metronidazole, D. Nitrate. It is iodide of NAK. Natalizumab is used in treatment of A. Multiple sclerosis, breast carcinoma, psoriasis, B-cell lymphoma. This natalizumab is used in the treatment of multiple sclerosis. Special feature of Glargine insulin. Now, Glargine insulin is a long-acting biosynthetic insulin. It remains soluble at pH 4 of the formulation and precipitates at neutral pH on subcutaneous administration. The onset of action is delayed. It produces a smooth, peakless effect. This insulin glargine is suitable for once daily administration, low incidence of nighttime hypoglycemia. It does not control mealtime hyperglycemia. So the special feature is it produces a smooth peakless effect. Mechanism of action of tylosin is it is 3 beta hydroxysteroid dehydrogenase inhibitor. Treatment of choice for cheese reaction is what is cheese reaction? Certain varieties of cheese, beer, wine, pickled meat, and fish, yeast extract contain large quantities of tyramine, dopa. In MAO inhibited patients, these indirectly acting sympathomimetics amines escape degradation in intestinal wall and liver, reaching into systemic circulation that displays large amounts of Na from adrenergic nerve endings, thus causing hypertensive crisis, cerebrovascular accidents. So it is C, phentolamine. Essential drugs, A, included in national pharmacopoeia should always be present at PSC. Those that satisfy the primary healthcare needs of population, life-saving medication. It is C. Post-marketing surveillance included in which phase of drug clinical trial? A1, B2, C3, D4. It is 4. Which of the following is most active against slowly dividing tubercle bacilli? A. Isoniazid, B. Rifampicin, C. Streptomycin, D. Ethambutol. It is rifampicin. Drug contraindicated G6P deficiency is A. Chloroquine, B. Primaquine, C. Quinine, D. All. In fact, all of them are contraindicated in G6P deficiency. Which of the following anti-cancer drugs are competitive inhibitors of tyrosine? Imatinib and sunitinib, letromazole, bicalutamide, fulvestrant. It is imatinib and sunitinib. Which of the following drug might have caused the effect given in the picture? It is insulin, which causes this effect. It is lipohypertrophy at the site of injection due to inhibition of lipolysis can be seen with this. Ranibizumab is a monoclonal antibody against A, IL-6, CD20, VEGF, VEGF. It is VEGF.